today for this webinar. This is how to develop your health suite. We will get started in a few minutes. While we're waiting for everybody to get settled and to join in, it would be great if you could pop in the chat where you're joining us from today, what college or school or other facility you're at today. And also, if you are teaching T-level health, what year you're currently teaching. So it might be you've got your first cohort, or you're into your second or third year, or perhaps even you're going to be starting in September. So it'd be great to hear from you where you're at in your journey at this point. While we're just waiting for everybody to join, we'll just let you know that this is our second Learning From event for T-level teachers. If you missed our first event a couple of weeks ago, we were lucky to be joined by David Paynes, who is the lead at New College Swindon. We had a tour of his health suite and were able to interview him as well. So he was able to talk about some of the issues and problems he's overcome over the past 2 years at Swindon. That's available to watch back now. So don't leave us just yet to watch it, but we'll pop a link in the chat for you to be able to click on, and it's going to be there for a couple of weeks. So you can watch it at your leisure and share with your colleagues as well. So great, got a few people putting in the chat where they're from. That's great. I know some people are on half term this week, so if you are, thank you for taking the time out from your holidays to join us. And if you're back at teaching this week, thank you for popping out in your lunch break to join us now. We've got a great guest today, and I'm going to introduce him in a few moments. Just a bit of housekeeping first. Mics and cameras are switched off anyway. If you've got any questions throughout the webinar, please feel free to pop them in the chat. We've got some time at the end to put questions to Dan. The webinar is going to be recorded, and you'll get a copy of the recording tomorrow. And again, please feel free to share that with colleagues. It's great to be able to share this information with everybody who wants to know, needs to know. So just a little bit of information about us. So we are Sim & Skills, and we are one of the leading suppliers of healthcare simulation equipment and clinical skills trainers in the UK. We offer a wide range of products from different manufacturers, and our aim is to give you everything you need to succeed in simulation. We've got a really experienced team working for us. Our members have got backgrounds in clinical practice, healthcare simulation, and in education as well. I'm Nicola Cook, I'm the Marketing Director, and I'm your host for today's webinar. And I'm also a teacher, so I'm very, very familiar with what it's like to be setting up with a new curriculum, developing a new learning environment, and all the stresses and the pressures that is involved in that, which is one of the reasons why we were so keen to support T-level health teachers, because we understand how difficult it can be when you've got a lot of things going on, you're juggling a lot of responsibilities. So we've been supporting T-level health teachers for around 2 years now, and some of the ways that we've been supporting staff is that we produced a product guide which matches equipment to your curriculum, so that you know you're getting resources that are actually going to help enhance your teaching, and they're going to teach the skills that you need to teach your students. We've got a new product guide coming out in a few weeks' time that's been updated with some new ranges of products. Because you've signed up for the webinar, you'll get a copy of that because we've got your details, so look out for that. Our experienced team, as I mentioned, lots of experience in healthcare simulation. They can take you through the purchasing process from start to finish, giving you lots of advice and guidance so you know that you're getting the equipment that you need. And we have some training options available for some of our products as well, and that can range from online demos to having videos that you can watch back in your own time, and on-site training as well. So please do get in contact with us. Our details are in the chat if you need any extra advice or support at all. So on to today's webinar. We are very, very lucky to be joined today by Dan Blood. Dan is the Senior Simulation Technician at the University of Surrey. He's been there, I think, Dan, is it for over 10 years you've been at Surrey? So a whole range of experiences, and I'm quite sure Dan has probably encountered many of the things that you perhaps are dealing with in your own health suite. So I'm going to hand over to Dan now, who's going to do a bit of a presentation for us. Then we're going to have some questions with him, and then there'll be time for Q&A at the end. So I'm just going to stop sharing my screen, Dan, and you can take it away.
Can you hear me? There we go. Good. Got the window all to myself. Hi, my name's Dan Blood. As Nicola said, I'm the senior simulation technician at the University of Surrey. Having had almost 15 years of experience in sim, that includes also Canterbury Christchurch University before I moved here. I have broken plenty of things, made a lot of mistakes, spent way too much money, and I'm hoping to help you avoid some of those traps without coming a cropper to them. Anyway, so I have a presentation to go through now. What I'd like to do is show you a little bit about my my facility. So I work at Surrey Clinical Simulation Centre at University of Surrey. And we ask, what happens here? Well, there's lots of clinical skills, and we have various models to support that. And we start the basics. We take our undergraduate nurses, paramedics, physician associates, midwives, and mental health professionals through things like hand washing and aseptic technique, maintaining a sterile field, to the basic life support as you see on screen now. We do that for a range of ages, and we try to encourage EDI in our models. We're really happy to see changes like this come through, and it's developing every generation. We move up to more complex skills. So as you can see here, we've got some cannulation arms where our students are placing cannulas. We also do things like catheters. Our paramedics will do things like needle chest decompression and use interosseous injection equipment. And then we'll move. And we have a strong core of patient handling in our curriculum for the protection of both the patients and our trainees. Lots and lots of patient handling. We move up to scenarios. So we not only do we work with mannequins, the sort of high fidelity mannequins that you see on screen now, we also work with actors. So as opposed to clinical skills, we're just learning how to practice their skill on a piece of a body. They're now applying those skills to full patients. I completely agree. If anybody has any questions, please throw them up in the chat. I'll be happy to pause at any moment. We work with a diverse spectrum of patients from young to old, and we deal with from birth to death at all ages. This here is from a postpartum hemorrhage scenario that we do, where our midwives learn to work in teams. So we put them through complex situations where they learn roles and they learn skills and how to apply those skills in stressful situations. And then we provide them as much complicated equipment as we possibly can, so that they might get some experience of it before they go into their placements. We use simulated vehicles. This is our ambulance. This was donated to us by a local ambulance trust. We had the front cut off. I want to say it's for complicated health and safety reasons, but it just didn't fit in the room without with the cab on. So that's it's a fully functioning fancy caravan with a tail lift at the back there. So we can tie together our clinical and non-clinical environments. So our paramedics can rescue a patient from our clinical flat. Our community flat. They can pop them in the ambulance, treat them on the road, and then arrive at the hospital to hand over it to our nurses. So we get that full interprofessional journey. We also use some real vehicles too. We use mixed reality. This is our immersive suite. We tend to use this for distracting environments. So instead of paramedics rescuing someone in a grey box, they'll do it in a loud, distracting environment full of movement and colours and sounds. And we're hoping soon smells. We do some really cool things with actors and some complex scenes. So this here is a nightclub scene where our paramedic students again were sent in to deal with a stabbing in a nightclub. But we can use these tools to show the power that they have in the environment. So they can come in, they decide that the lights go up and the music goes down. They manage the crowd. They make the demands. We're trying to give them that kind of agency in their role. We work with actors. We do some very silly things like here's a person hiding their legs with a blanket so that they can use a birthing abdomen underneath. But they give us an amazing emotional range. Here's Richard being a parent to one of our child mannequins, and our nurses have to go and talk to them about something quite sensitive. We do a lot of debriefing, and that's helped by our camera system. So we can try and get footage from all over the sim center to create videos of the students' actual performances. We find that's very, very impactful. And we do all of this until they become professionals in waiting. And they look awesome doing their jobs. And they do it in all kinds of environments. And look at that teamwork. You can see it in that picture there. Brilliant. But that's not what my team do. We're the technician team. We support all of that. So we are myself, Dan Blood on the left there, Carrie Pemberton and Alex Roussos. And we three support about 80 individual academic users at the moment who teach around 1,500 students at any given time. And we do that by lots of Windows updates, managing equipment requests on a week in, week out, managing equipment and supplies. We apply moulage makeup to actors. And we even make our own models. So there's a couple of stoma models there, and there's some lacerations that you can see on the left. We try and do clever things with models. So like here we created a bleeding cut on an arm. So we try and do a lot of experimenting like this. That's a prototype, which is why it's gushing out the bottom of the wound, but we got better versions eventually. And we create resources such as labeling up drugs, which saves us a lot of time in collecting up the existing boxes and things. So this is just some water for injections, and we got some standardized printable labels, and we create our own drug labels. We make a lot of fake blood, and we clean up a lot of fake blood. We again, back to the cameras, we make sure that as much as we can is filmed. I do apologize if you can see my little monster son in the background there. And also we help our academics and clinicians put together really complex events and support those. So here on screen right now, you can see this was from a paramedic, a major paramedic event where they've got phones so they can pretend to be switchboard. They've got radio connections there. They've on the TV. They've got where everybody should be, and they're organising all the teams on the fly. It's a really complex event, and I might come into that in a little more detail later. And we program scenarios. This is actually on the complex side of what we do. It's usually they're in one state for say a few minutes, and then that'll change. Like their obs will decline. But yeah, so like I said, this is quite a complex example where it made a difference if they decide to put an oxygen mask at 5 minutes rather than 10, that sort of thing. And we also help control during the sessions as well, so controlling the mannequins and controlling patient monitors and things like that. Our trainees tend to get that's my maniac son. Trainees tend to get younger and younger every year, I swear. And part of our job is making sure that our academics, they know what we have and what we can provide for them. So this was a couple of summers ago where we got everything out of the cupboard. It really helped us because we'd forgotten about half of this stuff that was buried in the cupboards. And this is a really good process that I think everybody should get into the habit of, is when you have a lull in the year, grab everything you have, bring it out, and get all of your academics, all of your educators together, all of your technical staff together, and go and have an explore of what you can do. We go to conferences and we explore. We have a play with different equipment. This is Paul Wilder from another hospital up the road from us, who joined me on this conference, and he's currently testing out some wearable equipment where they can This is like an injectable chest piece, and there's a skin overlay that goes over that, and they can inject things to it. And then he's also played some wound makeup. He's got a terribly burned arm and a black eye there. Specific issues in our current setup that we'd like to oh, you're asking the audience. Lovely. Sorry, Nicola. Stephanie. We like to organize our supplies so they're very deliverable. These are trolleys that we're working on at the moment, where it just sorry, keep pressing the next button, where it currently contains several different models and all the supplies needed for those models, which means that we can deliver things really quickly, and it really takes out the changeover time between classes. Just to let you know, this is just an overview of what we do. I'm going to go into some much slower details soon. So what I'm really here to talk to you about is the support network that's available to you. Now, these are the ASPE champions. Anybody who hasn't heard of ASPE before, it's an organization, the Association for Simulated Practice in Healthcare. And it involves a mixture of different backgrounds. So there's clinicians, there are researchers, there are technicians, there are people interested in debriefing, there are people interested in really niche parts of healthcare education. What I'm a part of is the Technical Special Interest Group, and these are the technical regional champions around the country. So essentially, these are the people who are your first port of call. If you've got technical issues and you don't have anybody else that can help you, you can go to one of these people. They will definitely get you help somehow. There's going to be a link that I will put. Actually, I'll put that up now in the chat. Here's a link. That link will take you to a list of contact details for all of those champions. So if you want to go and find your regional champion, you can do so. And if you're just searching for them, if you've forgotten where the link's gone, just search ASPE Regional Tech Champions, and it will take you there really, really easily. Google will find it. And another thing that this group is really good at is organizing ourselves and sharing knowledge. So I'll just explain this timeline. This is the 2023 timeline that we went through. So we had webinars run by technicians. So these are volunteers among our group. And it started off in January where there was a webinar on 3D printing. So somebody with a 3D printer kind of explained the basics to everybody else and kind of how to get started. And then someone came in and explained about moulage and various different kinds of wound makeup and materials and how to prepare for it and the ins and outs of how to get started. Myself and two others ran a webinar around audio-visual problems. So we looked at sort of the general kind of audio-visual problems that technicians kind of face in their roles. Also some money-saving tips on buying equipment for that kind of thing. There's been, as you can see, there's been talks on mixed reality. There's been talks on equipment maintenance. And then towards the end of the year, we started focusing on conferences. So we knew we were all going to get together, and we'd see each other in the conference bar, and we'd see each other in workshops and things like that. So we decided to sort of collaborate on how to attack the conference as a group. And it was a fantastic conference. Everybody who went got loads out of it. So now I want to talk about a few things that maybe you've thought of, or maybe you haven't thought of doing this in your facility. So the first thing that came to mind is you're going through all these clinical skills, and it's great. You've had people practice them, but we all know that practice makes proficient. And this is our independent clinical learning space. And it's a very basic classroom, but also has some sinks, which are very helpful for some of our skills. Where we can lay out some basic clinical skills equipment, and students can book time in this space to come and practice skills in their own time. We've got really positive feedback about this space. It's really boosts people's confidence. And honestly, I mean, obviously, a lot of this stuff is more advanced than maybe T levels are going to delve into. But actually, I think you're in a better place to do this in a more independent way. Like your students, they're going to have less dangerous equipment to hurt themselves with. So I think you're well placed to set up a space like this and trust your students. Going to echo something that David Payne said, storage is key when you're running a sim center, and you're also going to want to think about how supplies are going to flow through your stores. Now, I think this was during lockdown, and it was just before that Brexit change was coming in. So we had two major kind of supply issues that on the horizon. And so our powers that be told us, you really need to get like a year's worth of supplies in, and here's the money for it, go for it. And so we did. And the main problem we had was, where is this massive heap of stuff going to go? So I urge you to look at what you might teach over the year, and then figure out that kind of like the minimum and maximum quantities that you want in your storerooms. It will save you a lot of headaches, because sometimes we've ordered in masses of things and we've been tripping over it for ages. So having a good plan for the flow of consumables is going to save you a lot of headaches. Also think about your backs. Now, on the left, you're going to see this black and metal shelving unit thing where we were keeping our mannequins in our old facility. And this is in a different building in the university before we moved into our lovely, shiny hospital environment. So I worked there for, it was about 6 or so years before we moved over to the new place. And it was great. We had this workshop run by the faculty, and we had them whip up this rather industrial looking shelving unit. It was on wheels, so we thought we could move mannequins around. We were destroying our backs using this thing because it was really awkward to get them off that bottom shelf, and quite dangerous to get it off the top shelf as well, not to mention get stuff back up there. So what we got when we moved into our new building was this lovely mortuary shelving. Now it's a huge setup that we've got loads of mannequins, but if you have any mannequins, you will find that they will get in your way eventually. And so having a space like this, you could get a single column, or you can get some ones that load onto the side, so you can make it work for your space. Having something like this will really save your backs. It'll actually save you quite a lot of time, and it will really help your changeovers. So when you're swapping between different classes. So these shelving units are from a supplier called A.R. Twig and Sons. It's an actual mortuary supplier, but they found quite a niche among Simtex and Sim facilities. Think about laundry. If you've got hospital beds that you're training in, or towels, and you're using fake blood, well, this is what happens when midwives use our towels. And we've got an entire stock of pink towels now, stained from blood, just for the midwives to use, because otherwise we're just going to ruin all of them. But large industrial laundrettes tend to be not the best organized operations. So you need to be very organized and on it, and you need to be able to. You need a good sort of standard operating procedure for how you're going to follow those suppliers up, and make sure that you know what they've taken from you and what they should be bringing back and when. That's just a warning. We've had a few issues with different laundrettes. We've got an okay one at the moment, but they're never perfect. Anything you can do in-house is fantastic if you have space for a washing machine. Think about how your students might be able to do a lot of work for you. Now, this is the result of our old paramedic bag setup. Is that these bags were provided by the technicians in the room, and we do all the tidying up at the end. And often this is the mess that we've come into. We've got to untangle wires. Most of these bags have been completely mixed up. The contents is just jumbled up inside. It's all jumbled up between the bags. And So we've got to sort all that, and pretty much every time. And there was a period of my career where I basically lost one of my technicians because she was doing a daily check of these bags, and that's all she was doing. It was taking her so long to get through them all that she was doing nothing else. So we worked with our paramedic tutors, and we created this wonderful system. These are actually the updated versions of the bags for our different ambulance trusts that we work with. And our students now sign these bags out and do checks on a table that's to the right hand side, and then they can restock them. And then once they're finished, they come in, do a check and restock as well. And what that has been doing is giving them more agency. It gives them responsibility over the equipment that they're borrowing. And we've found that this equipment is kept immaculately now, and it's wonderful. So it's taken a huge chunk of work off our hands, and it has given the students a far better understanding of the equipment that's involved in their skills. Boxes are your friend. Find some stackable boxes, some ones that will slot into each other. Ones that will slot into each other, and preferably have a lid and will stack. These ones are really good. They're from a company called Manutan, and we can just at the end of a class we can chuck everything in these. We've got a designated space for spent equipment, so something that needs either the maintenance, it needs untangling, it needs cleaning, it needs putting back to where it needs to where it lives, and that means that we can quickly tear down a classroom, and then we can focus on the important part, which is setting up for the next thing. And then during the day, the next day, we can then be putting things away in our nice slow time schedule. Think about getting some kind of label maker. On the left, we have got a color label printer, which prints on like plastic labels, so they're waterproof. And this one's actually a full color version, so you could do some really nice detailed, say, medication labels. And on the right, we've got the usual sort of printable like templated sort of label. So you can download the template, you get an Excel or a Word table, and you just fill in what you need. Put these in your printer the way up, and you can just mass produce labels like this. And this has been a massive time saver for us. It also means that we can make our medications really standard, so there's not lots of confusing packaging for them. Get demos from suppliers. Now, I've put a little jokey comment here. Beware of silver-tongued salesfolk. That's a lovely man called Jake Rahman there, showing us this fantastic mannequin who's it's an obese mannequin, and there's plenty of nursing skills that we can do with her. Brilliant piece of kit. And if I'm honest, he's one of the good guys. He's one of the people, and I will credit Sim & Skills with this as well. What we want from our salespeople is we want them to come and see us and see what our needs are, and then we want them to we don't want them to sell us the shiny thing. We want them to try and solve our needs, because that's worth the money we spend. I'm sure some of you may have already been sold some shiny equipment that's now sat in the cupboard for too long, and I'll be really sorry to hear that. I've bought plenty that we shouldn't have had, that we were convinced we needed it, and that it served a need, but then it would just never really fit into our curriculum, which is really sad. So part of my job is trying to figure out how to get that used. But to reiterate this message, get demos from suppliers. There's some amazing simple equipment out there, of all different price ranges. There's something to suit your needs at pretty much every price point. You've just got to manage your expectations. You've got to know what you want, and just be honest with yourself. I think I've come to the end of my slides. So is my camera coming back on? So thank you for listening to my presentation.
That was fantastic, Dan. Really, really insightful, and some really good, actionable, practical tips in there that I'm sure T-level teachers joining us today, or other sim staff joining us today, can really take on board. We're going to have a bit of a Q&A between you and I now, and then we can, if there's any questions that anybody else has thought of that they want to put down, please feel free to pop them in the chat. And some of the things I was going to ask you, you've already answered anyway. But I guess one of the first things I should ask is, obviously anybody watching the images of your facility, and I've been very lucky to visit you there, and it is an amazing facility, and it's a university facility, but obviously it didn't start like that. So for any teachers watching who are feeling quite overwhelmed by the level of facility that you've got, would you be able to talk to us what it was like sort of 10 years ago, when it was almost in its infancy, and it might be perhaps where people are watching today, they're at that point? Oh, can't hear you. You're on mute, Dan, sorry. Just wait for... I'm hoping he's not telling us a really good pearl of wisdom here that we can't hear. It's the secret that we all need to know, and we're not able to hear him. But it is, as Dan's probably going to explain in a minute, what's important to see with the universities is that they obviously have been doing simulation for quite a number of years, many of them 10 to 15 years, but it wasn't always like how you see it today and how you see it now. Yes, we can hear you. So yeah, just if you can talk about what it was sort of like for you, sort of either when you were at Canterbury or in Surrey, when you were at sort of the position where T-level teachers are now.
Lovely. So third time's a charm. So 11 years ago, I walked through the doors of University of Surrey. The course was being run entirely by educators, so probably where you are now. So we had people who were essentially the clinicians who were just getting into education, and they hadn't got any kind of established budgets yet. And we're talking prior 2010 here. Well, no, sorry, 2010 had just kind of happened. All those regulations. There was a changing in the nursing regulations where now there's a minimum number of hours that nurses must go through in simulation. So practice hours, those came in. So the importance of simulation centers was boosted greatly. It was fantastic. So that's probably why the job was put up. I was their first technician, and when I found them, they were relying entirely on out-of-date materials that they were able to get from their local trusts, and usually that's because they were basically fishing out of the bin at work, not the clinical waste. The out-of-stock stuff from the storeroom. So we had pretty much embarrassing situations, like they had the catheter to show around of what catheterization was like. They didn't have any models that supported that. There was a Noelle, which is a birthing mannequin, and she was in bits in a cupboard. Somebody had used her once, broken her, put her in a cupboard, and she'd never been seen again. And that was a massive investment at the time, and it was absolutely pointless. So it basically did not lead to any student outcomes whatsoever, which is terrible. A few years down the line, I'd been there for a few years, and what I'd shown is that with student support, with technician support, we can free up our educators to do more student support. They've got more time for marking. I'm sure you'll appreciate that. And they've got more time to plan their sessions rather than deliver, mark, which is what they were always used to. A few years later, I they decided to expand my team, so I managed to get Carrie. So I became a senior technician from that point. It's around 2016, and there was some investment in the facility I was working in. So at the time, we had sort of 2 wards, and they were pretty much just like classrooms with beds in them. So one of those was refurbished to really look like a ward, and it was fantastic. It was expanded. So sadly they took away one of our storerooms to do that, to expand into, but they created a much larger ward. They made it more hospital-like, and we really saw the benefit from that immediately. So if you're ever in the position of designing a space, trying to make it faithful to the space that you're expecting them to work in is a really good idea. But also, don't sacrifice storage. That was criminal. Nicola, did I just interrupt you?
No, I was just going to say on your point there that if you are just starting out and you're thinking about how to use the space, do you think it is worth paying a visit to either a college, if you have got a college nearby that have started a few years ago, but also to visit universities like yourself to be able to go and have a tour and go and see themselves how you're using the space?
I think if you're going to go and see other training centres, you should do it to see how they overcame certain challenges. One challenge that we had was things like getting all of the hospital trunking sorted. So that's the plastic railing around the room with all of the gas ports and the plug sockets, the light switches, the this, that, and the other, all over them. So to make that look like a hospital. Even getting the gas ports that weren't going to be connected to gases off the companies that sell them was quite a nightmare, because they want to do the proper safety checks to make sure that you're going to be responsible with what they're providing to you. So there was a lot of project management around that. So if you go and see other facilities, go and do it to overcome problems. What I would say, if you're trying to represent a healthcare environment, go to places in your local trust, or if you've got relationships with the universities or colleges around you, go and see their placement partners. Go and see what their hospitals look like. Go and see what defibrillators they have on their crash carts. Go and see what procedural boxes they might have spread around. For example, Wiffrey recommend these toolboxes. You'll have a toolbox with all the kit needed for preeclampsia, and all the kit one for all the kit needed for a massive obstetric hemorrhage, that sort of thing. But what we found in our trusts is that people have been creating one trolley with everything on, and we've now recreated that in our sim center, and it's proving really useful. It means that the students who have already been on placements, they're coming back into our facility. We've got something they recognise sat in the corner of the room.
And that's a really good point, because I think from our experience of talking to T-level teachers, one of the things that they are concerned about is being able to create that environment that reflects the environments that students are going to go into. One of the big differences with T-level health is the placements that students have got to go on to, and they're not just in an observable position in the placement, they've actually got to be hands-on. So to see what they've got in simulation reflected then in the trust they're going to go to is a really good point. So we're talking about some of the sort of the big challenges that you faced along the way as you're developing the suite to be what it is today. But what are some of the kind of daily challenges that you face in your role that you have to kind of overcome, or have found ways to work around to save yourself time?
Yeah. So equipment requests has been the bane of my life for 14 years. That is, when they happen, what they contain, the level of detail, not sort of like linking up to my understanding of the equipment, that sort of thing. And really, when they happen is the real important one. What we're essentially asking our tutors to do is plan a session well beyond when they would, like, they'd really be thinking about going into a room and looking at and doing a lecture. They'd probably give themselves maybe a week and a half to plan a lecture. But if if that's when they're asking for equipment for a session, then that's too late. We can't deal with any kind of supplier issues. Like, and we use NHS supply chain for a lot of things because they get ridiculous prices. I don't any of the suppliers, even say Simmons, the wonderful Simmons Skills here, could compete with what the NHS is able to negotiate on the scale that they use medical supplies. So the prices on there are amazing, but as a supplier, they are horrible. There are times when they didn't have the equipment in the warehouse that time, so they just send you a note saying we didn't have it, so we're not sending it to you. You're going to order it. So if with problems like that, if you've only got say a week or a week and a half to go, then you're going to end up with classes that don't have any resources if people aren't giving you enough time. So what we've instigated over the years is we sort of fostered this sort of 3-week process where and we've been able to identify the different steps. So we tell our staff about the supply issues that we're having to negotiate all the time. The fact that this one equipment request we're dealing with is actually one of many. So we're looking at a day 3 weeks in advance. There are actually 5 different events going on that day, and you're just one of them. So we need people to appreciate that there are other users in the class in other classrooms who we're helping too. And then there are also things like equipment's being used over those 3 weeks. So over those 3 weeks, we need to top up sort of maintenance and spare parts, things like that. So there might actually be circumstances in those 3 weeks where an unforeseen thing happens and it damages a piece of kit, so it stops being suitable for the teaching session we're preparing for. So there are a lot of hurdles to get over, let's say. And I think the best thing that we've done recently is start creating templates for all of the skills. So it's such a simple concept. I wouldn't be surprised many of you are doing this already. To say that if you're delivering, let's say, some basic life support on a resource, and everyone's going to need exactly the same kit for that. It doesn't matter which course you're on, that's going to be the same kit. So instead of having people rewrite that list every time and tell us what version of the kit list they want, we've got that list on a Teams folder that they can see. They can't edit, but they can see it, and that means that they know exactly what we're going to get them. So they just need really that simplifies their life a lot, because they don't have to plan a basic life support session. They just have to say we want to do one of those in 4 weeks' time, and we know exactly what they want from that point. So it's really cut out that the need for reinventing the wheel every time.
It definitely seems like planning in all of its forms is the key to running a successful health suite, because all the issues that you're talking about in terms of consumables that different lessons are going to need, different task trainers, a maintenance schedule and storage, all of those things have got to be thought about at the start of the year, however big your teaching group is. You might be the only teacher, you might have a team, but you've all got to try and work out when you're going to need things and at what point and how much you're going to need.
Yes.
So there's a lot to consider.
And actually, now you mentioned a combination of things of the buying consumables and the storage, and then also having multiple classes going on. When you've got multiple sort of independent sessions going on, you've got to be careful of somebody robbing Peter to pay Paul. If they take supplies out of the storeroom for their session, but actually you bought them for someone else's session, so now the shortage hasn't gone away. It's just moved to someone else, and it might be that's something that's going to really cause a panic. So if you can make your storage nice and secure, make sure that only the people managing the equipment requests have access to that, so they can, or at least that everybody's taking responsibility for what they take.
And for many of the people joining us today, I imagine from the experience we've had talking to T-level teachers that the degree to which you've got technical support really varies. You might be lucky enough to have a technician with you, or it might be that you're having to be your own technician and specialist as well as being a teacher. So Dan, for anybody who is having to do a lot of this themselves, have you got some really sort of almost like your top tips for how you're going to be able to plan out usage of equipment and maintaining it and auditing it, so that amongst all the other things that you've got to do when you're teaching, it's a much more straightforward process?
Absolutely. So let's start with using the equipment. Cheat sheets are your friend. So come up with a simple list. Oh, you might want to call them idiots' guides. I don't mind. Just get those simple steps identified. Equipment comes with really helpful instructions, but it's usually buried. What you want is usually buried in a giant PDF document. Figure out what you want to do with that piece of equipment. Work with your low tech champion or somebody they recommend, and put together some kind of cheat sheet for that piece of equipment. It's the key steps to what you want to do with that piece of kit. Moving on, once you've used the piece of kit, have checklists for maintenance. So there's things that we didn't think about really for years, such as rotating our batteries for equipment. Lots of different batteries have lots of different requirements. So first of all, know what your requirements are. If it's a lithium-ion battery, you want to let it run down a bit, but like regularly charge it, but not leave it on all the time. If it's sort of a lead acid battery, you want to make sure that you really use it all, and then give it a good charge. They have all different requirements. Look up what your batteries need, and then create not just a process for each battery, but a checklist for when you last gave it a good charge, because you don't want to switch on a piece of equipment, realize not only is it flat, but the battery is no longer accepting charge, because that's really a killer. Batteries, certainly in sim equipment, are a killer of budgets. They're so expensive, especially if you've got mannequins. Have a process for cleaning out anything with tubes and liquid. So we really recommend using deionized or purified water if you're going to put water through any tubes, because that will give you about a 3-week window before any kind of growth will happen in terms of sort of algae, things like that. So let's say that you've got you've got a model, you're going to use it in a couple of weeks' time. So there's no real reason to clean it out between there. If you've got deionized water, that will be absolutely fine. But then eventually you just need to flush more fresh deionized water through, and it'll be absolutely fine. If algae does end up building up in your models, then it tends to block tubes. That's when you get the really, really horrible problems. And you'll end up having to send it back and have maintenance done, and maintenance gets expensive too when it's unforeseen. I think
Those are
the main.
Yeah, those are some really, really helpful tips. Having those guides, so you know what to do, and the staff you're working with know what to do, whether it's with kit, or like say the cleaning and the maintenance. That's so beneficial and so helpful to think about. The last question I was going to ask is just to focus again on the support that's out there, because as we've already said, there's such a variety of different setups with colleges and schools as to how much technical help that you've got. So can you just remind us again of where people can go locally to access some technical support?
Absolutely. So if you're not seeing the link in the chat, just Google. Oh, that's not coming up. But yeah, search for ASPE Regional Tech Champions, and it will give you access to all of these wonderful people. There's an email address for each and every one of them, and we're all volunteers, and we're all dedicated to providing that support.
So yeah, find your
hopefully
local tech champion, and there'll be somebody available to help and support you. If you've got any questions at all for Dan, we've got about 5 minutes left before we need to finish. So if you've got any questions, any bit more advice that you'd like to have about something, or to know where to go for some extra support in your area, please feel free to pop them in the chat, and we can pop them to Dan. Likewise, if in a few days' time we think, oh, there was something that I really wanted to know and I didn't get a chance to ask, please feel free to email us, hello@simmonsskills.com, and we can pass your question on to Dan. I'm sure he'd be very happy to answer any questions that you might have. Steph's just put the email address in there for you. I've got one question actually, because you mentioned it when you were talking about your facility, because this is something that comes up and perhaps something T-level teachers might not be aware of. But you said about your actors that you have, which sometimes get called standardised patients, particularly for T-level health. In the assessment process, it can't be a mannequin, it has to be a person that the students are interacting with, and that can be difficult if you are the tutor, to elicit those unbiased responses from your student. So where do you get your actors from?
I'll caveat this with other suppliers are available, but we currently use a supplier called Sim Actors Limited. Now they're generally London-based actors who I think they can probably be sourced from numerous places. But that's Sim Actors Limited. They started off as Kim, Kate, and Richard, the original three we were using, who were mates of one of the tutors that we had. And when these three actors were helping with all of our sessions, we were paying them, and then we needed a few more people at the same time. So they'd sourced people for us, but we had to pay each one as an individual supplier. And then it turned out our tutors were going to the other actors instead of Kate, Kim, and Richard, the people who found everybody. So they decided to start Sim Actors Limited, so they can now find us all sorts of actors. It also takes the admin side off our hands, which is fantastic. So they have provided us with mixtures of people of various ethnic backgrounds, people with knowledge of emotional issues, people with disabilities, people, young actors, old actors, people who are happy to have my physical examinations done on them, non-invasive. I mean, the most we've done is had our students do some breast exams on them. So, but it gets really good feedback. And these actors are very experienced at this now and can give fantastic patient-side feedback. They're really good at not only giving those emotional responses, but tempering them to the needs of our trainees as well. I am aware of an organisation called the Casualties Union, and they source volunteers. So I think the process behind that is that you cover the cost, like the travel cost of the actor or actors, and then I think you make a nominal donation to the charity. But apart from that, so it's a lower cost version. You need to be a bit more prescriptive for them, I believe. So they're very used to being standardized patients, but they will come and do exactly as they're told. But they're not there to come and develop your characters for you. Which is what a benefit that we've had from sim actors.
So you've got that package all there ready to go. That's really, really useful to know. So that's all we've got time for today. Thank you so much, Dan, for joining us today. We really appreciate you taking the time to talk to us today and to share your experiences. I hope that everybody watching has found it really useful as well. And as we said, if you've got any questions, please feel free to email us. We can pass them on to Dan. And don't forget about the Technicians Network there that is there to help and support you. So if you've got any worries or concerns, I know there were some people in the chat who are just getting started and getting ready for September. If you've got lots of questions, please feel free to fire them away, and we'll do our best to answer them for you. And thank you very much for attending today.
If I may just say, I'm very active on LinkedIn. If you follow me on LinkedIn, I will talk about simulation stuff quite a lot. And if you have any questions as well, I'm happy to answer via that.
That's great. Thank you so much. And thank you everybody for joining us today, and we'll see you again soon. Have a good day.